Good afternoon, everyone. Michelle Mavison here with Oregon Health Authority Medicaid Program. We have folks still joining, so I'll go ahead and just give it a moment and we'll get started here in just a second. All right, we might have some folks still trickling in to the virtual space, which is absolutely fine for any time that anyone's able to join us. And thank you again, and good afternoon to you all. And thank you for your time today. For those of you that have been able to join, we will look to have this recording made available after the check-in today, and all of it will be shared via email as well. And just otherwise, some housekeeping reminders. So one, that this is being recorded and can be shared with colleagues that aren't able to attend, and two, to just make sure that you're muted if you're not speaking. So *6 to mute or unmute on the phone, and then it's that microphone icon that you see with a strike through to have it muted, or you can click to unmute. For today, we don't really have a lot of new things to report that haven't already been shared via email, but just given how long it's been since we've regrouped on this program, and as we gear up for activity to begin, wanted to have this space to check in together, let you know the updates and things that we have to share, and that have already also been shared by email, but just to reiterate some of those things. So we'll run through some highlights and status of where everything's at, and then saving some time as much as possible towards the end. So if you do have any burning questions, or you're a newer provider on this program, that we can have some time just to answer any questions or anything that folks might have. And we have another upcoming check-in together on September 4th at 4 p.m. And that's when we'll really get into some of the work together that I'll highlight today that's not been started yet, but will be starting very soon. So without further ado, and just again to remind people and orient them to where we're at, because there's a lot of different GMT programs these days. There's the new private provider program that's being implemented, and system changes for that are affecting our program here, which I'll get to more of in a moment. And then we, of course, have the fee-for-service GMT program that's been operational and long-standing since 2017 that Carmen Armendariz with Oregon Health Authority oversees. So just not to be confused with any other GMT, this is specifically about the Ground Emergency Medical Transportation Coordinated Care public provider, so public or local government-owned provider supplemental payment program. And these programs are designed, just kind of backing up for a moment, where this all comes from is established out of that House Bill 4030 that passed in 2016, and we operationalized this program beginning in 2021. It operates on a calendar year, and each year we get approval or not from CMS to operate this program, and it's really to cover the high costs of these life-saving services of basic and advanced life support for folks on OHPs, including those that are CCO enrolled. So specifically, this is for OHP member CCO enrolled, utilizing those qualifying services during the periods of time that CMS has approved, and we're able to draw down federal dollars to supplement those high costs. You already have the separate base amount that you receive reimbursement for these services, but this is add-on. This is additional supplemental dollars with federal funds included. And more linked that I can share out about the program Like I said at the end, if there's anyone with burning questions or newer on the program, we can talk more about the basics, and I can share past webinars that we've had about kind of GMT CCO Public Program 101. So happy to share some of those. But as far as for today, we're going to focus on these topics. And in the interest of time, if folks want, they could go ahead and drop into the chat with their name and affiliation, the organization that they're here representing today. And again, from OHA, Michelle Mason, I'm the lead on this program, and I oversee and am involved in all the other GMT programs under Medicaid Transportation Services, as well as air ambulance and non-emergency medical transportation as well. So that's me, and yeah, feel free to drop those into the chat. Thank you, Joyce. Thank you, folks. And for today, like I said, we'll focus on where exactly we're at for the calendar year 2024 program, same for the 2025 program, and what's coming next when we look forward to calendar year 2026. And just some of the basics about the program requirements, and then what we're looking for out of next steps and the check-in coming up on the 4th, and how we're going to be proceeding in those various areas as well. So yeah, just a reminder that each year we do have the preprint submission and must be submitted and then approved by CMS, and that's for each distinct calendar year. Right now we have it approved for calendar year 2024 and calendar year 2025. In that approval we've received from CMS has the eligible period of time, which is always on a calendar year, as well as the rate that's been approved. That rate can be adjusted to reach the total amount that CMS approves for a given year, but typically we've, like for 2024, for example, we've had that rate consistent throughout the year, and we already know what's approved for 2025. Right now within operations, and as you've seen from the emails, with the calendar year 2024 program operations, we are working to finalize system changes. It's mainly been to allow for the new GMT private program being implemented. Those system changes are finally being finalized now, and we can expect program activity that we've been all waiting for. You know, we've concluded for the first half of 2024, so that includes providers knowing what the non-federal amount is, an admin fee, and submitting those to OHA that we use then to draw down federal dollars for the total supplemental payment. So that process we concluded now for the first half of 2024, but we've been needing to be able to move forward and start that process for the second half of 2024, and we haven't been able to yet because of these system updates needed that we've been waiting for. So one good thing that will come out of that is with these system updates, we're still kind of in a workaround that we've been in, using some automation out of the system, and we'll get a bit more automation with these updates for this existing program as well. So I'll be putting together guidance and how you can access potentially more reports and things out of the system directly about this program, even that tie down to the claim level. Because all of these rates go back to a rate for the claim for when you have the qualified paid encounter for advanced or basic life support during that eligible calendar year. That rate is associated with a claim, and then that gets added up to the total. And so yeah, you'll be able to get more insight rather than just waiting for, you'll still get the payment report after the activity happens. That'll always be sent from OHA, but there might be more you can access out of the system directly that you haven't been able to access in the past. So that's one nice thing to highlight about what will come out of these system changes, besides just making us wait to process the second half of 2024. So some silver linings there. But once we do have that set up in the system updates will be completed soon, and as soon as early September, we'll be able to process for the second half of calendar year 2024. So we can confirm those non-federal amounts and admin fees to get that process rolling, just like we concluded for the first half of the year. We can start for the second half of the year, and I'll make sure to share guidance and things that we can put together highlighting some of those system changes that can have more features that you can access out of the system for tying back to this payment for this program. So more to come on that. And then as far as 2025's program, we have had it approved with CMS. We've just been essentially severely short-staffed. I've been spread super thin between non-emergency and emergency and air ambulance. So we haven't started that initial activity as soon as we typically have in past program years. But we do have it approved for 2025, and so we can proceed. We're getting ready on OHA's side. We've been working on getting hired, more staff hired within transportation services, and now we have a new dedicated person to non-emergency program policy work, which is perfect. It really helps free me up to get back to next steps for 2025 and other things that we haven't been able to put the focus on as much so far this year. But yes, we're gearing up to send, starting with that email confirming intent to participate for 2025, confirming we have the right best updated contacts, and then we would go through that typical verification we do to confirm your service license and what date your service license is active for, and that you are a publicly owned or local government owned entity and things like that. The typical verifications that we've done in past years, we would do again for 2025 and get that process started so we can get intergovernmental transfer agreements in place with OHA that allow for that transfer of funds for the drawdown of federal dollars that go to providers, and then also it being passed through CCOs, just like we've done in past years. So earlier today, I sent out an email and reattached the most updated list for contracting with CCOs, and that's something providers can definitely proceed with. Sometimes you have what is considered like an evergreen contract, basically a contract that stems multiple calendar years. That's all within the flexibility and the decision between the provider and the CCO to however that looks, whatever type of agreement it is. We do have a fact sheet about this that I can reshare as well. But it's flexible in type, the agreement between a CCO and a provider. And you can have that running for multiple years. Again, we don't know, like for instance, we don't know if we're approved or not for calendar year 2026. That has to be approved by CMS. But you can have something in place with the CCO still that considers you as a participating provider of theirs technically, and that just allows for the CCO to pass through this directed payment from them to the provider to you, since it is CCO enrolled folks that these services apply to that are part of this financial payment program. You do need something in place with that CCO for that enrolled member that had those services during that time. So those are always good to have in place. And if you don't have one already for 2025, if you had one for 2024, this is a great time to reconnect with those contacts that you have at CCOs. There might be some new ones based on this most updated list as well to be mindful of, and that's something providers can definitely proceed with, using that attached list and reaching out with CCOs to either update an agreement or have a new agreement for 2025. And then attestation of that is required, at least one, to OHA, just as we've done in past years for the program. So next, we'll be reaching out to confirm intent and get that whole ball rolling for 2025. So we'll be reaching out in a separate email to each provider and then proceed from there to get everything in place and confirmed, because as soon as we do wrap up with 2024's second half of the year payment processing through the system, we would want to turn right away to 2025 as quick as we can to get those processing as well. We already have that approved, and so we can get together and verify what we need, get agreements in place to allow for that. And just, again, reminding about 2026, our next step is to look at preprint and engage on that as we put it together and submit to CMS by the end of September. So we need to, by the end of next month, submit to CMS, and that's for calendar year 2026. Noting just from the past, we had about a 6% growth from year to year, and the development and approach for this, and of course we'll get into these details a lot more once we actually start working on the preprint together. So more details and more questions and answers. We'll get some of our subject matter experts that help put together the preprint from OHA for this and other programs like the hospital programs that run on preprints. So we have some folks we can bring, some subject matter experts to help talk about as we engage on 2026 submission, just all of the details and ins and outs. But essentially, the development and approach that has been used is looking at actual data, looking at inflationary factor, and based on that actual data and utilization from the past, we're able to project and forecast to sure. And we also have to make sure it's actuarially sound. So more to come on that, but that's just to kind of highlight what that is and where we'll be headed soon in our next check-in to really deep dive in, and probably have another dedicated meeting in September where we can dive in even deeper. That's how we've done it in the past, is we usually have a regular, just broader check-in together during that time, but also for folks that want to really deep dive on it together, appreciate that engagement, and we can dedicate some extra time for that within next month. And then otherwise, just the reminders of provider requirements for this program. And again, that'll be part of what we verify when we email out and make sure that folks are interested to participate, because this is an opt-in or opt-out program. It's not required that providers participate, but if interested, then we would move forward to verify that you're licensed and enrolled with Oregon Health Plan and all those basic requirements that have been long-standing for this program now since 2021. And then again, also to have the agreement in place with OHA that allows for the transfer of funds from provider to OHA for the non-federal portion. That's because of how the House bill establishes this program, that needs to come from the provider. It can't be from general funds, state funds. So providers pay into the program with the non-federal and admin fee, and that intergovernmental transfer agreement with OHA allows for that, as well as the overall process for the program where we draw down the federal dollars for total payment. And then, of course, you do also need to have the agreement with CCOs and then an attestation of that to OHA. Again, this and I'll make sure if our contact is still Terry Rudell, it has been consecutively throughout this program so far, but we'll be reaching out soon. Once we verify intent, verify eligibility, everything checks out, then we would just move forward in that with someone from OHA Contracts to directly reach out with you all as confirmed participating providers for 2025 and get that agreement in place. And then again, the one with CCOs as well. And I can share out information about this. I know I'm kind of running through it fast, but a lot of you are very familiar with this. So just to highlight, where we're at for 2024 for the second half of the year to process, and then what we're starting now for 2025. And then again, we'll be talking soon about preprint, more about what that entails. It also has the quality measurement for the CARES. It's the cardiac arrest registry to enhance survival. So that's what we've used. We have to have quality measurement as part of the preprint. And so more to come about that and our goals and objectives and how you can become a contributing member of CARES to help us fulfill and meet that quality metric goal. So more to come in the preprint topics, upcoming topics for that. And otherwise, like I said, I'll just make sure to share out resources. I'll make sure everyone has my direct contact info in the program inbox, just if anyone has anything that they think of or need help with, or if you're newer on this program and you want some one-on-one time, some orientation towards the program, we can do that. And otherwise, you can expect more to come from us on guidance, a step-by-step of the timeline and process steps for 2025 as we get that going, and where exactly we're at to get that additional activity for 2024. And then also any of the new features out of the system updates that can be beneficial for providers to kind of see a sight line in through the system and the financial operations. And then we'll also look forward to just other areas where we can create consistency, more alignment between the GMT programs now that we have so many. And a lot of you we know participate both in this CCO public program and the fee-for-service public program. So we really want to see, even if they're ran on different models and things like that, however we can have consistency or common terms used or things like that. So we're developing a survey to get more insights from folks, because we know there's a lot of room for improvement, and especially as we do get more automation or features that we can utilize to make this program work better for everyone. We're just very, very interested in that. So appreciate your feedback in advance, and I'll be sure to share out once we have that survey developed and any of these further guidance, common terms, definitions, anything like that to share. We'll make sure to send your way. And I see some questions coming through, which is exactly where we're going next, is just to see, what questions or things folks or comments folks have. So let's see. Will we be getting a copy of the PowerPoint presentation? Yes, absolutely. I will share this out directly after today's meeting. And as we roll right into, like I said, you'll be receiving a separate email from me today or tomorrow regarding those first steps for 2025, essentially starting with confirming intent to participate for 2025 or not. So yeah, one of the follow-ups from today will be this presentation, a copy. When can we expect to see the request for intent? Oh yeah, so yeah, that'll be coming today or by tomorrow. I'm working on those right now with our team. Yes, good question I forgot to mention that in my updates. So for 2025, we do have an updated attestation form that'll be available. We've had a pretty old one linked on the website, but we are updating that. So it'll be basically the same information, nothing new that you would have to provide on the attestation form, but we will have a new one dedicated for 2025 to complete. Like I said, as you're able to use that, list of CCO contacts and start reaching out to get things in place, we definitely want to have that form available for you all, so you can send that attestation that goes with that over to OHA. So we don't want you to wait for it. Go ahead and feel free to reach out and connect with CCOs, but we are working on that form to get updated and made available very soon. Nothing really new from this meeting. Others should expect email. Yes, yeah, that is basically the new thing, is to expect that intent to participate this week, even today. There will be the new attestation form, and then also that we will have finally that activity started for the second half of 2024 soon. And with those system updates, like I said, there can be some new features that might be really helpful for folks, just to be able to get more info that you could want for your purposes, reconciliation purposes or otherwise. So just more added information, nothing being taken away from program payment reporting, but some additional features that might be available within the system. So I'll just be putting together guidance for how to direct you to wherever that is, wherever that information is in the system that can help tie back to these program payments. And then, yeah, the best way to contact me is definitely email. I'll go ahead and drop that in right now to the chat as well. And we have our program inbox that we all check regularly, including myself, but happy to take, direct emails from anyone reaching out as well. Any other questions from anyone? And I was going to say, along with the presentation copy, we'll make sure to have this recording available for us too. And if no other questions, just really, again, appreciate everyone's time. I hope this was meaningful. I just didn't want to cancel it just because we didn't have something substantial to share that's new, but just wanted to hold some space with you all and thank you for everything you do. Really appreciate you all, and I'm happy to continue, in this program together and with everything we have coming up. I'm excited, especially for anything we can get out of MMIS that's helpful for providers to grab directly, not waiting for me or someone at OHA for. So I'm super excited about that, but more to come on that feature, what that'll look like. But yeah, otherwise I'll stay on the line if anyone has anything. And otherwise, just, yeah, thank you so much for your time. And yes, hopefully the updates are helpful. Thanks.